and that's why we actually put the mouth and the teeth into our inflatable gut. So we're very, very important. And did you know that your oral health doesn't just affect your digestion, but your gut, your immune system, and even your brain health? So I'd like to welcome Sue Camp. Sue's a registered nutritional therapist, a certified functional medicine practitioner. She completed her BSc and MSc in personalised nutrition. She holds a practitioner certification from the Institute of Functional Medicine, and which uses a systems biology approach to uncover the root cause of health issues rather than just managing your symptoms. In her clinical practice, she focuses on stress, digestive system, weight management, hormone balance, and optimizing overall performance. She also leads the nutrition team for the Health Matters group in Central London. And in this talk, Mouth Matters, How Your Oral Health Shapes Gut Health, Immunity and More, Sue will reveal how imbalances in the oral microbiome can drive inflammation, gut dysbiosis and chronic disease. So from food choices to natural oral care practices, you'll leave empowered to take charge of your health, starting with your smile. So please give a warm welcome to Sue Camp.
So we're going to change the focus today a little bit from the gut microbiome to the oral microbiome and our oral health, because I think our oral health is perhaps, what would I say, it's a microbiome that we don't always think about. It's underrated, it's a little bit neglected, and really to our own detriment. And what I'm going to show you today is I'm going to show you that if we take care of our oral health, that it has implications for overall systemic health. Can you hear it all right? Or is there a funny, are we all right?
Bit
okay.
of a funny noise.
There is a bit of a funny
noise. Try this.
Let me see if I can, is that better? Is that better? Yeah? Is it still popping? Better? Better? Okay, let me know, otherwise I'll try that. Otherwise I'll talk loudly. But we're going to be recording it anyway.
I don't think we can hear you now.
Can you hear me now? No? Can you hear me now? Are we still popping? We're still popping? All right, I'm going to try that. Okay. Oh, that's
much
better. All right, let's go with that. So, this is me, I think. Oh, no, wrong one. So, my name is Sue Camp. As Catherine said, I'm a nutritional therapist. I did my training with functional medicine. I run a private practice. I run a couple of clinics in London, and I do some work in the clinical education and nutraceutical industry as well. So, our talk today is about what is a healthy mouth. And I want to introduce you to oral health and an oral microbiome. And then we're going to talk about oral inflammation, dental caries and periodontitis. And we're going to talk also about assessing oral health, because we can assess it. And then, of course, what do we do about it? What is the food and the diet and the evidence base behind taking care of our oral health? And what are the particular nutrients that we need to make sure that we've got oral health? So that's what I hope we're going to be your takeaways today. And I'm going to start today with Dr. Weston Price. Anybody heard of Dr. Weston Price? Anybody read any of his work? So he was a researcher in the 1930s. He was a Canadian dentist. And he was known primarily for his theories on the relationship between nutrition and dental health, but also nutrition and dental health and overall health. And he traveled the world. He did a great job. He traveled the world and he went to villages in Switzerland and the Ate Hebrides and Eskimos in North America and Polynesia and all around Africa and Australia. And in 1939, he published a work called Nutrition and Physical Degeneration. Can you hear okay at the back? Yeah? Nutrition and Physical Degeneration. And the book concluded that aspects of the modern Western diet, particularly flour, sugar, and processed fats particularly, cause nutritional deficiencies. The nutritional deficiencies weren't only related to dental caries, but also to the structure of the face and the structure of the jaw, and therefore systemic health. And so what we see in his work, and you can see this on his website, all sorts of interference here, is that we see that healthy mouths need natural diets. And we can see in this first example of this girl on the left, she's a Seminole girl from America. She has a wide face with plenty of room for her dental arches. The girl next to her has a much narrower face with crowded teeth and reduced immunity to disease. And these two girls were brought up with different diets, one with a traditional, native, whole foods, unprocessed diet, and the next diet was much more of a modern processed diet. The same with these two boys. This was a Samoan boy born on the left, who was born to his parents who ate native foods and part of their traditional diet. And the Samoan born on the right was born to parents who had abandoned that traditional diet. And so he has crowded dental arches and much more susceptible to tooth decay. And so Weston Price's comment was that good dental health begins with the diet of the parents, depending what the diet of the parents is, right? So he was very much pro traditional diets and maintaining traditional diets, which were whole foods and unprocessed, not only for dental health, but also for the whole structure of the jaw and the arches and how that led on to systemic health. And so we see that looking back, two of the greatest shifts of our dietary carbohydrates, two greatest shifts in evolution was about the adoption of a dietary carbohydrate and a change to farming diet and the advent of processed industrial flours and sugars. And so when we changed from a hunter-gatherer diet and shifted from our traditional farming, from a hunter-gatherer to our farming diet, we shifted our oral microbial community to much more of a disease-associated microbiome. And now those bacteria that are contributing to dental caries that we see in our mouths, they became dominant during the Industrial Revolution. And that's what we see over this time. So that modern oral microbiota are much less diverse. So both Emma and Dana have been talking about diversity in our microbiome, and our oral microbiome is now much less diverse than our historic populations, and certainly than we were hunter-gathering. And we see much more of a dominance of bacteria in the mouth that are contributing to dental caries. And that was from this shift into a much more industrialized process. So our mouth is our gateway to our entire body. And what does a healthy mouth look like? We talk about the oral cavity having about 9 different niches, if you like. So we've got a hard palate and a soft palate and a mucosal, a buccal mucosa, and a throat and tonsils and teeth, and we have saliva and plaque. And these 2 different surfaces on which bacteria can colonize. The hard and soft tissues of the teeth and the mouth, and we have a biofilm. So the biofilm is the plaque, and that's part of our oral health as well. So we have these different niches, and after the gut, the oral microbiome is the second largest microbial population of the body. We have a huge amount of oral bacteria. We have 100 to 200 different organisms in our oral microbiome, and we need to take care of them. And they consist of bacteria and archaea and fungi and parasites and protozoa and viruses, and they interact with our host and with our mouth. And when we're kissing, we're swapping bacteria. So you've got to be very careful who you kiss and make sure that you only get the beneficial bugs and none of the bad ones, because we have a very dynamic bacterial population in our mouth that we want to take care of. We also have level of saliva in the mouth. Some people struggle with levels of saliva, and saliva is important for maintaining pH and for washing through the mouth. So saliva plays an important role in oral health as well. Sorry, there's our mouth and our gateway. So introducing the oral microbiome, it comes from, we start from the egg, there are different factors that determine the composition of the oral microbiome, starting with age. So when we are young, there are changes in the host and our habits, and our oral microbiome changes through life, and I'm going to show you where it starts. And so we see that the diversity of the microbiome changes as the diversity of the host changes. There are host and environment, so our genetics and integrity of our immune system also affects our microbial combination, and the environment in which our host is. So our lifestyle habits and our dietary habits all contribute to our oral microbiota. There is a habitat within our mouth, and that changes in terms of different oxygen levels, levels of pH, and nutrition levels as well. And then we have this biofilm maturation, so the development of plaque in our mouths that increases with age, and it can increase with the depth of the levels of the plaque in the microbiome as well. And there is an interaction between saliva and our plaque. So some shedding of the mucosal cells get washed away by the saliva. So these are all important aspects of our microbiome and of overall health. So when is the microbiome first acquired? And we see that during birth there is a massive transmission of organisms. Those babies that are born via vaginal birth have a microbial footprint of their mum's birth canal. And those that are born through cesarean births have a microbial footprint much more along the skin microbiome of the mum. So there is a big difference in the microbial footprint depending on the birth. The delivery mode, as we see those types of microorganisms that the baby is first exposed to. And then after birth, the mum's oral microbiota represents the most important source of the infant's oral microbiota through breastfeeding, through attention and affection of the mum. And breastfeeding plays also an incredibly important, significant source of oral microorganisms. So very good reasons why we want to breastfeed for as long as we can, so that we're supporting our baby's healthy microbiome development. There is also a horizontal transmission from siblings and from brothers and sisters that might be older or younger, or friends that we see in nurseries and playgroups, and also pets. So pets play a really important exposure to microbiome for children, and we would always suggest that the children grow up with pets for a whole bunch of immune resilience and microbial interactions. And of course then diet and oral hygiene and systemic health and orthodontic appliances, they all have an influence over a microbiome. So where does this all start? Building the foundation. Soon after birth, there is this process of colonization of the oral cavity that begins, and there's an adherence to what we call pioneer microorganisms on these oral surfaces. The early oral microbiome then dictates the composition of the long-term stable microbiome, and there's a succession of diversity. So if we've got a diverse diet, we've got a diverse oral microbiome and a much more stable microbial community, which is what we need. A more diverse community is healthier, it can better respond to changes in the environment, and of course microbial diversity is decreased in disease. And microbial diversity is also decreased from these kinds of assaults on the oral microbiome. So when we have a course of antibiotics, we may think about the impact on our gut and the diversity of our gut, but it also impacts the diversity of our mouth. So we want to be aware of the diversity of our oral microbiome when we're taking antibiotics as well. Dietary changes make a big impact on our oral microbiome. We want lots of fiber, just as Dana and Emma have been saying earlier. We want lots of fiber. And we want to reduce the high sugar foods because that provides the environment for a much more caries-associated, dental caries-associated bacterial environment. Alcohol can also impact our oral microbiome, sorry folks. And of course, smoking is hugely detrimental to our oral microbiome. The effect of smoking is stable and persists for several years after quitting. And of course that includes vaping and pouching and chewing of tobacco and all of these other unusual tobacco habits. So we want to make sure that if we're going to start with oral microbiome, smoking is a good place to start if we can quit it. It creates an anaerobic environment, it damages our host immunity, it alters the pH of our oral saliva, and the antibacterial effects of the toxic substances in cigarette smoke. So we definitely want to make sure that we can get rid of that. So moving then on to teeth decay and the start of oral decay. And what we need, what happens in a kind of scenario of decay is that we need sugar, but it's not only about sugar. And it's an indication of the susceptibility of the tooth, of genetic susceptibility, and as well as the bacterial composition of the mouth and the quantity and quality of the saliva, as well as the time of those fermentable carbohydrates that have been in the mouth. So how long have we been eating sugars and carbohydrates and processed and refined foods? And that's all going to impact the onset of dental caries and decay in our teeth. So it's the increased consumption of these fermentable carbohydrates that can lead to changes in the environment, leading to pH changes and a change in the biofilm, and favoring these very acidic bacteria and dental caries in the teeth. And then that leads on to gingivitis. And gingivitis is the first step of periodontitis. It starts as gingivitis. You might feel this as bleeding and swollen gums or pain. You might see some bleeding if there is any bleeding on flossing, or if you're using any interdental brushes. And if this is left untreated, this progresses on to periodontitis. And periodontitis is then the loss of the periodontal attachment and the supporting bone. And it becomes a chronic inflammatory response. So we're talking inflammation in the mouth and inflammation of the periodontium, which is the tissue surrounding the teeth and supporting the teeth. And this destroys the periodontal ligaments, the connective tissue, and the bone supporting the teeth as a result of this chronic immune and inflammatory response. Now, periodontitis is common. It affects 10 to 15% of adults, and moderate periodontitis, and 40 to 60% of adults. So if you think about all of the people that you know, or perhaps all of the people in your family, how many people in your family may be dealing with gingivitis or periodontitis and ignoring it? And maybe you're doing that yourself. So maybe you're flossing or brushing your teeth and there's some bleeding gums. Are you ignoring it, or are you dealing with it? It's the most common cause of tooth loss worldwide. And there is evidence to suggest an inverse relationship between income and periodontal disease, with a 1.8 times increase of periodontal disease in lower socioeconomic groups. And that may be financial constraints, lack of access to dental resources. So this is something that we think about through that. And the severity of the disease also increases with advancing age, but it can be prevented. And what happens is that patients often seek oral care too late because the early stages are usually asymptomatic. So we want to catch it early, because this is the crux. What happens in the mouth doesn't stay in the mouth, and inflammation in the mouth results in inflammation in the body. There is a very well-researched mouth-body link, and the microbiome of the oral cavity is not an isolated microbiome. None of our microbiome populations are isolated. They're all linked. There is a highly interconnected series of microbiomes across the human body, forming this kind of microbial biosphere. And we see from the literature that there are biologically plausible mechanisms linking inflammation in the mouth to systemic inflammation and disease. Through systemic bacterial dissemination, there is a bacterial translocation from inflammation in the mouth that can contribute to promotion of atherosclerosis in the heart, that can contribute to inflammation-induced pregnancy complications, that can trigger inflammation in the liver, and can contribute to gut dysbiosis. And these are some of the mechanisms. So there are two main mechanisms that have been described to explain how periodontal disease could contribute to systemic disease. And one of them is what we call a direct mechanism. So as that periodontitis progresses in the mouth, those periodontal pockets become ulcerated, providing a direct entry point for periodontal bacteria into systemic circulation. So that's a direct mechanism. But there is an indirect mechanism as well, where this inflammatory response in the mouth contributes to indirect systemic effects. And so the source of inflammation starts in the mouth, but it contributes to an increased inflammatory response around the body. And so what we see is that oral health can contribute to conditions such as Alzheimer's disease, cardiovascular disease, cystic fibrosis, a range of cancers, diabetes, rheumatoid arthritis, and more. And so this is our message today, that we want to take care of our oral health so that we are inhibiting the possible progression to systemic diseases around the body. I'm just going to have a look at 3 of them for you to give you some further detail around this. So starting then with periodontitis and diabetes. Diabetes is a major risk factor for periodontitis, and susceptibility to periodontitis is increased by approximately 3-fold in people with diabetes. So there's very much a two-way relationship between diabetes and periodontitis. In that diabetes increases that risk for periodontitis, and the inflammation in the mouth negatively affects that glycemic control. But the good news is that there is a statistically significant reductions in HbA1c, which is a measure of our blood glucose, in the short term if we can treat the mouth. So if we take care of that inflammation of the mouth, if we treat the mouth and we take care of those dental caries and the pathogenic bacteria that may be in the mouth, that can have an impact on the improval of glycemic control and overall diabetes. We also see that periodontal pathogens, there is a particular pathogen called Porphyromonas gingivalis, have been detected in the brain tissue of humans with Alzheimer's disease. And the pathways for the microbial access to the brain are many. One of them through is what we call a leaky blood-brain barrier. So we have the semi-permeable barrier between the bloodstream and the brain, and that can be triggered through inflammation, through traumatic brain injuries, through toxins, through food additives, through a whole bunch of different triggers can trigger leakiness in that blood-brain barrier. And this can then open up the pathways for pathogens to cross into that blood-brain barrier and contribute to neurodegenerative diseases. And the authors of this paper felt that it was reasonable to assume that periodontal disease is a modifiable risk factor for cognitive impairment and dementia. I think dementia and Alzheimer's might be one of our greatest fears. And so this is one of the things that we can do, starting from early on and certainly from midlife, taking care of our oral health as one way that we're inhibiting the onset of these kinds of diseases. And then the other connection that I wanted to make was to cardiovascular disease. So periodontal disease is a risk factor that may initiate the development, maturation and instability of some of those atheromas in the arteries. Again, through two different mechanisms, through direct invasion of these pathogens in the bloodstream and by systemic inflammation around the body. And it was suggested that improvements in the condition of one disease positively interact with the condition of the other. So if we can take care of our mouth, that may help our heart disease. And if we can take care of our heart disease, that may help our mouth. And that's what we saw in this consensus report in 2019. So treating periodontitis had beneficial effects on reducing our endothelial, improving our endothelial function, reducing inflammation, reducing blood pressure, and arterial stiffness. And so all cardiovascular patients really should be advised that they need oral health assessment. And all those patients diagnosed with cardiovascular disease, make sure that they have an oral examination because there is this two-way relationship. It's not only a disease structure, but also in terms of health. And so how do we assess it? And these are my questions to you today. And I'm going to ask you to ask yourselves all of them. So, do you brush your teeth twice a day at least? Or do you have a manual or electric toothbrush? Do you floss regularly? Does anybody around here floss every day? Some do, some don't. Do your gums bleed when you floss? Thinking about that. Are your gums sore or tender or swollen or inflamed? Do you have bad breath? Do anybody you know have bad breath? Are any of your gums receding? Do you have any loose teeth? Do you smoke? And how often are you visiting the dentist? And if there's any practitioners in the audience, my suggestion and recommendation is to have these conversations with your clients and for you to have these conversations with your family, because we don't talk about oral health enough. And it's really at our detriment. And how often do you visit the dentist and the hygienist? We want visit to the dentist and visit to the hygienist. So we can test our oral health as practitioners. We are able to order these oral microbiome tests. It's a really easy test. It's a salivary sample that we send in, and we can map out the bacterial composition of your oral microbiome. And this is a UK-based company. They're actually based here in London, and they report on pathogens in the mouth. They report on commensal bacteria. What do your good guys look like? What do the bad guys look like? Are there risks for dental caries and gum disease and halitosis and thrush and the oral microbiome function? So if this is something that you're concerned about, it's certainly something worth testing. And then, of course, what do we do about it? So the first thing we want to do is start with food. We always want to start with food first. This is a great book by Dr. Stephen Lin. He calls it the dental diet, and he has this dental food pyramid here, which he's suggesting. So lots of veggies and fruits at the bottom. We want lots of those. Some fermented foods in tier 2, nuts, seeds and spices, a little bit of fats and oils in tier 3, and he keeps grains and fruits at the top a little bit less. There may be some debate about that, but overall it's a good structure. And he has 4 principles for his diet. He talked about keeping the jaw, the face and the airways healthy and strong. He wants to give the mouth the nutrients it needs. We're going to come on to the nutrients. We want to feed the microbiome, and we want to give foods with epigenetic messages. So every time we're putting something in our mouth, we're giving our body a message. We're turning genes on and turning genes off. When we're feeding our bodies with processed foods, we're turning genes on and off that are different to whole, unprocessed veggies, fruits, natural spices. And so we're going to start with prebiotics, probiotics, symbiotics. And I think Emma or Dana touched on the difference. So prebiotics are indigestible fibers that feed our good bacteria. So all of the onions and garlics and leeks and Jerusalem artichokes, all of those, they feed our probiotics. Probiotics are our beneficial microorganisms, and the symbiotics is the combination of probiotics and prebiotics. and they have beneficial effects on gingivitis, on our oral health, on dental caries. They interact with the plaque, they interact with the immune system, and of course, so consuming all of those probiotic-rich foods, such as kimchi, kefir, and any other fermented foods that you can tolerate, can all be really helpful. And then just to touch on some of the nutrients, we couldn't really talk about oral health without talking about vitamin D. So, yes, we absolutely need vitamin D, and findings show a statistically significant relationship between low levels of vitamin D and higher risk of dental caries. Now, vitamin D is a subject which, as nutritional therapists, we talk a lot about, because here in the UK, most of us have suboptimal levels because we don't have enough sunshine. We don't have enough sunshine for a long time of year. So unless you've had a sunny holiday this summer, my suggestion is you might want to test your vitamin D. You may ask your GP, he'll probably won't do it, but you can order a fingertip test for £31 from vitamindtest.org and know what it is, because it's at this time of year that we want to start supplementing vitamin D to carry us through the winter. It's a crucial hormone, pro-hormone, for lots of reasons, for immunity, for our mental health, and also we see that for every 10 nanomole rise in vitamin D, there was a decrease in the risk of dental caries. So my invitation to you is get it tested, be aware of your vitamin D, and dose accordingly. And then Weston Price talked about Activator X, and he talked a lot about animal proteins and fat-soluble nutrients. And it was a key substance that people of the past obtained, but that modern nutrition didn't adequately provide. And so he used a combination of high vitamin cod liver oil and high Activator X, he called it butter oil, and this was the cornerstone of his protocol. And this protocol stopped the progression of tooth decay and reversed it without the need for oral surgery, causing the dentin to grow and remineralize. Anybody got any idea what that Activator X might be? It's vitamin K2. So we need vitamin D, and vitamin D and calcium work together. Vitamin K2 we need to be taking with our vitamin D, because what vitamin K2 does is it helps, we call it gamma carboxylation. It activates certain proteins that keep the calcium in our bones and in our teeth and out of our arteries and tissues. So my recommendation to you is to take your vitamin D3 regularly, but also to take with it vitamin K2. B vitamins, just a little summary here of the role that B vitamins play in oral health. So any cracked lips, you might want to think about B1. Any inflammation of the tongue, we might want to be thinking about B2 and 3. Sore tongue, B6. Any kind of halitosis or painful ulcers, we might want to think about B12. And of course, iron plays an important role as well. So thinking about all of those B vitamins. Optimal health also needs zinc. So zinc is a crucial mineral that we probably don't talk enough about. It's found in our saliva, in our dental plaque, and in the hydroxyapatite of the dental enamel. It plays an important role in healthy teeth formation and the reduction of halitosis, inhibits bacterial growth, and may prevent periodontitis. So zinc is another crucial mineral that we want to think. And we've got some, and we've got some oysters there, because oysters is your best source of zinc. So if you're looking for some zinc, a plate of oysters is a good way to get it. And then I just wanted to touch on magnesium. So we think a lot about calcium. We might be thinking a lot about calcium when we're thinking about dental health. But magnesium is necessary for the activity of calcium and phosphorus in preventing dental caries. And studies have established that it's magnesium, not calcium, that forms that kind of hard enamel and that resists decay. So yes, we need calcium, but calcium without magnesium only forms the soft enamel. A reduction of the dietary intake of magnesium has been associated with periodontitis and caries, and so we want optimal levels of magnesium as we can. And so as a kind of summary, here's a summary of kind of our dental hygiene. Ideally, we want regular dentist visits. We want regular oral hygienist appointments if we can. We want to be brushing twice a day with an electric toothbrush for at least 2 minutes, and replace the head of that every 3 months or so. We want to floss regularly or use TP brushes. I have a colleague who is a dental practitioner, and she has a little saying. She says, everyday FBI, and her FBI stands for floss, brush, and then interdental brush. So that's your routine for twice a day: floss, brush, interdental brush, and remember your FBI. Water flossing, oil pudding. There's some really great oral probiotics on the market. You might want to think about that. There's some probiotic toothpaste on the market as well. You might want to be thinking about that too. So there's some different options that we can do to really elevate our oral health. And then I just wanted to leave you with something else to think about, and that is nose breathing. So mouth breathing, when we're breathing through our mouth, affects our dental health because it dries out our oral structures and decreases the saliva production. And we talked a little bit earlier about the importance of saliva in our oral health. It helps to neutralize the acid and flush away bacteria. And so without this, the risk of decay and inflammation of the gum and the bones supporting the teeth really increases. Now, during sleep, mouth breathing can decrease our pH as compared to normal breathing, and can contribute to less restorative sleep. So thinking about nose breathing might be something that you, just to kind of bring that to consciousness around the way that you're breathing. Thank you. Thank you for your time. Thank you.